Hi, welcome to Module 4 of the Patient Compliance in Oral Care course. In this session, we're bringing everything together, taking what you've learned and applying it to a real patient case using the GPS approach. Let's dive in. Let's pick up where we left off in Module 3 with the same patient. Here's what we know so far. The patient brushes twice daily with an electric toothbrush, uses mouthwash in the morning, has struggled with flossing in the past, doesn't report discomfort, but experiences gum bleeding during treatment, is pre-diabetic and working on reducing sugary drinks. Rather than focusing just on motivational interviewing techniques, we're now going to walk through the full GPS process. Remember, your role is to guide the patient, not tell them what to do. You're there to support their autonomy and motivation. You'll take a slightly more directive approach once you've helped them set a SMART goal, because that's where action begins. Step 1 is helping the patient identify a goal that matters to them. For this patient, a natural goal might be, I want my gums to stop bleeding when I brush. Now, to support change talk, you want to explore any gaps between what they want and what they're currently doing. For example, they care about oral health, investing in an electric toothbrush, and regularly brushing twice a day, but they don't think flossing is for them. That's a discrepancy to explore. Try asking, thanks for sharing how you care for your teeth. Is there anything about it that concerns you? It sounds like you're really committed to your oral health. How do you feel about flossing? These questions help uncover what matters most to the patient, allowing them to identify a goal they feel motivated to work toward. Now that we have explored a goal, the next step is to develop motivation. One way to do this is by using an importance ruler, a simple tool that helps patients explore how much they value a change. You can ask, on a scale from 0 to 10, how important is it for you to stop your gums from bleeding? Let's say they answer 6. Instead of trying to push them to a higher number, try asking, why 6 and not a lower number? This gets them talking about why they care about the goal, helping them build their own motivation without feeling pressured. Once the patient recognizes their goal, identify what behavior could help them achieve their goal. Rather than jumping in with a solution, guide them to explore what works for them. You might ask, what changes do you think could help improve your gums? Let them lead the discussion, whether it's trying flossing again, switching to an easier alternative like interdental rubber brushes, or making other adjustments like reducing sugar intake. If the patient is unsure or hesitant, you could introduce some options. Many patients who find flossing difficult have had success with interdental brushes. Have you ever considered trying them? The objective is to have the patient choose a behavior that fits their lifestyle, making change more likely. Once a potential behavior is identified, take a moment to explore the pros and cons of not adapting versus adapting the behavior. Use open-ended questions to encourage the patient to reflect, recognize their motivations, and move toward a decision that feels achievable for them. You might ask, what do you like about your current routine? If you keep brushing only, how do you think your gum health will change over time? If you were to try interdental brushes, what benefits do you think you'd notice? What, if anything, might make it difficult to start? This helps them evaluate their options thoughtfully, without feeling pressured. Now it's time to turn your discussion into a SMART goal: specific, measurable, achievable, relevant, and time-bound. For example, to help prevent my gums from bleeding when I brush my teeth, I will use an interdental brush to clean between all my teeth every day before brushing at night. This ensures the goal is clear, realistic, and trackable, setting the patient up for success. Now that we've looked at goal setting, let's move on with planning and self-monitoring. Setting a goal is one thing, sticking to it is another. Help them visualize when and how they'll follow through by asking questions like, when will you do it? Where will you keep your interdental brushes? What might get in the way? Then address potential barriers by creating simple if-then strategies. If I forget to buy brushes, I'll set a reminder immediately. If I find myself too tired at night, I'll try doing it in the morning instead. This makes the behavior easier to maintain. Now that we have explored a plan, the next step is to develop motivation. Let's use the importance ruler again to help the patient explore how much they value a change. You can ask, on a scale from 0 to 10, how confident are you about using interdental brushes daily? Let's say they answer 5. Instead of trying to push them to a higher number, try asking, why 5 and not a lower number? This gets them talking about why they care about the goal. And develop motivation and self-efficacy by building on even small successes. Now that you've planned when and how your patient will adopt the new behavior, revisit the SMART goal to make it even more achievable. For our patient, that might mean refining the goal as follows. To help prevent my gums from bleeding when I brush my teeth, I will clean between all my teeth with an interdental brush every night before brushing. I'll start my bedtime routine 10 minutes earlier to fit this in. This small tweak makes it more achievable and easier to follow through on. Self-monitoring helps build awareness and reinforces habits. Introduce a self-monitoring tool like a simple diary or app where your patient can note successes or challenges. You might ask, would tracking your progress help? What would work best for you? An app, a checklist, or something else? A simple habit tracker, whether digital or paper, keeps them engaged and accountable. Before they leave, set a follow-up date. Let's check in a few weeks to see how things are going. This keeps them accountable and gives you a chance to adjust the plan if needed. And remember, GPS is not a one-time conversation. It's an ongoing, iterative process. Patients' goals, challenges, and motivations can shift over time, so revisiting and adapting the plan is key to long-term success. Now it's time to practice. On the Module 4 page, you'll find 3 patient scenarios. Your task? Role play and apply the GPS approach. Use the GPS template provided in this module and the MI techniques from Module 3 to practice what you've just learned. And remember, there's no perfect way to do this. What matters is working collaboratively, supporting autonomy, and using this approach as an ongoing way to guide patient conversations. Ready? Let's go.